Good afternoon, folks. I have B for you. We're discussing cerebral amyloid angiopathy, CAA, a condition where amyloid protein builds up in the walls of the brain, blood vessels, and a new analysis that found people diagnosed with CAA had about a fourfold higher chance of receiving dementia diagnosis within 5 years compared with people without CAA. What is CAA and why it's hidden? CAA is a blood vessel disorder in the brain caused by amyloid protein deposits that weaken vessel walls. It often causes few or no symptoms. So many older adults have it without knowing. It's typically identified only with MRI or PET imaging. The Cleveland Clinic estimates 23 to 29% of people over 50 have moderate to severe CAA. How the study was done. Researchers analyzed health records for nearly 2 million Medicare beneficiaries age 65 and older. Tracking new dementia diagnoses from 2016 through 2022. Participants were sorted into 4 groups: no CAA or stroke, CAA only, stroke only, and both CAA and stroke. Key results and what it means. About 42% of people with CAA were diagnosed with dementia within 5 years versus 10% of those without CAA, roughly a fourfold increase in risk. Importantly, the elevated risk was present even among people with CAA who had never had a stroke, suggesting the amyloid buildup itself can impair brain function, not only damage caused by strokes. Clinical implications and conveys. The study's authors recommend proactive cognitive screening after a CAA diagnosis and addressing modifiable risk factors to try and slow decline. The report is primarily and presented through the American Heart Association context. So findings may be refined after peer review and further research. Quick takeaway. CAA CAA, common and often silent, and this large observational study links it to subsequently higher short-term risk of dementia. Awareness and monitoring after a CAA diagnosis could help detect cognitive decline early. Summary: the NIH report delivers a profound reframing of dementia in the United States, drawing on some of the most robust contemporary data available. Researchers estimate that 42% of Americans who reach age 55 will ultimately develop dementia, a figure that dramatically exceeds earlier projections and signals a public health challenge of historic proportions. And signals a public health challenge of historic proportions. As the nation's population grows older, this elevated lifetime risks translates into a steep rise in new diagnoses from roughly 514,000 new cases per year in 2020 to about 1 million annually by 2060. The article positions dementia not as an isolated medical condition, but as a defining issue for the country's future, one that will reshape caregiving, healthcare delivery, economic planning, and lived experience of aging millions of for millions of families. Key findings: lifetime risks. The studies estimate that 42% of adults who live to age 55 will develop dementia, is nearly double earlier national estimates. Those older figures were based on narrower samples, less diverse populations, and less sensitive diagnostic methods. Age milestones. Dementia risk does not rise gradually, it accelerates. 4% by age 75, 20% by age 85. A sharp climb thereafter, reflecting the biological reality that dementia must, or that dementia is most common in in the old. Future burden. When these updated risks are applied to the U.S. Census projections, in the number of new dementia cases is expected to double over the next 4 decades, reaching 1 million new diagnoses per year by 2060. This surge is driven primarily by demographic change. More Americans living into their late 80s and 90s where dementia risk peaks. These numbers underscore a simple truth. Dementia is not rare and is not receding. It is poised to become one of the most consequential health issues of the 21st century. How the study was done. The findings come from a meticulous analysis of more than 15,000 adults participating in the arterial sclerosis risk communities. ARICA study, a long-running community-based cohort that has followed participants for decades. Direct cognitive assessments formed the backbone of the study. In-person evaluations allowed researchers to detect early stage or mild dementia that administrative data often misses. Phone-based assessments were used when in-person visits weren't possible, ensuring continuity and reducing bias. Hospital records and death certificates were reviewed to capture diagnoses that might otherwise be overlooked. This multi-method approach corrects for the blind spots of earlier national estimates, which often relied on medical billing codes or incomplete records. It also reflects a more diverse population, including substantial representation of Black Americans and individuals with genetic risk factors. Who faces higher risk? The study highlights important differences across demographic and genetic groups. Sex differences. Women's lifetime risk is 48 compared with 35% for men. This difference is largely explained by longevity. Women tend to live longer and dementia risks rises sharply in the oldest age groups. Genetic risk factors. The APOE4 gene variant remains one of the strongest known predictors of Alzheimer's disease. Two copies, nearly 60% lifetime risk. One copy, about 48%. No copies, about 39%. These findings illustrate how dementia risk is shaped by a combination of biology, lifespan, and social detriments of health. Public health implications and recommendations. The NIH report is clear. The United States is on the cusp of a dementia surge that will test the limits of its healthcare and caregiving systems. Healthy aging strategies, including cardiovascular health, hearing care, physical activity, sleep quality, and social engagement, are more important than ever. Many of these factors are modifiable and can delay onset or reduce severity. Targeted prevention for high risk groups could help blunt the impact. This includes individuals with APOE4, older women, and communities disproportionately affected by chronic disease and structural inequities. Healthcare planning must anticipate a massive increase in demand for memory clinics. Geriatric specialists, long-term care facilities, home-based support, and caregiving training. Policy innovation will be essential for projected rise to 1 million new cases per year will affect Medicare spending, workforce needs, housing, transportation, and the structure of family life. This report's message is not alarmist. It's pragmatic. The demographic wave is already in in motion, and preparation must begin now. Limitations and practical takeaway. While the study is one of the most comprehensive to date, it's still based on a single cohort and not assumptions about future populations. Trends, dementia at risk. Dementia at risk may vary across regions, generations, and social conditions. But the overreaching pattern is unmistakable. Dementia is far more common than previously recognized. In the coming decades, will be unprecedented for unprecedented numbers of new cases. The practical takeaway is both urgent and empowering. Prevention, early detection, and long-term care planning must become national priorities. The scale of dementia in the U.S. is larger and growing faster than we once understood, but the tools to respond exist. The challenge now is to mobilize them. Okay, guys, that is your B for today. I will be back on a little bit later for C, but for now, Gator Wellness, take care, folks.